everybody. Today we're going to talk about a facelift or facial rejuvenation. Many of my patients have asked me through the years, Doctor, what's the right time to have a facelift? And funny enough, I've never found this on a book. I have had the feedback from my patients, and patients typically come to me and say, Doctor, when I wake up in the morning, I don't look as fresh, rested as I used to, and I'm starting to do this. Once a patient starts playing with their face and looking in the mirror, it's because they just don't look themselves as fresh, rested as they used to. When I'm going to evaluate a face, I ask my patients, please bring me pictures in your 20s and 30s. All of us have a picture that we remember. Oh my God, if I could look like that I will be thrilled, you know? So bringing those pictures help me understand the situation and most importantly, what happened that took you to this stage right now. So I begin from the top of the forehead. The brows drop down, giving us a heavy top eyelids. The fullness of the cheek starts dropping down, increasing the nasal labial fold, the marionette lines, and the jowls, giving us some emptiness in the tear trough. And we end up having protruding bags under your eyes and slight redundancy of the skin. And last is just a small fat deposit with a couple of strings, vertical lines. So that's the pattern of the aging process. And last is just the fine lines around the mouth that typically done by the loss of fullness on the mouth. So that's pretty much the problem. What's the solution? Well, basically it's one of my most passionate procedures to do a facelift. What I like to do is I begin with two tiny incisions inside the hairline. I make this incision parallel to the tail of the brow, undermine the forehead, relax the muscles in the center horizontally, and then simply do an elevation in the corner of the eye. This makes your eyes more open, fresh, restful, and almost 90% of my patients, I don't have to touch their upper eyelid. At the time we redistribute their forehead, the skin is lifted up nicely. Continue with an incision in front of the ear, around the earlobe, behind the tragus, and around the earlobe. I like to undermine the skin, overlap and bring fullness back into the cheekbone, and just eliminate the excess of skin without the need of pulling too much of skin, which is going to give you a fish mouth or wind tunnel look. Makes it very nice, soft, fresh look. And I finish by doing liposuction under the chin. And typically this is precious fat. I don't like to throw it away. We like to transfer that into the nasal labial fold, provide beautiful definition into the lips, and this will soften out those fine lines. And just tight properly the muscles to create a suspension on the neck and just eliminate whatever excessive skin you have. Most of my patients I finish with a small incision under your lashes where I flip the skin, trim a little bit of the fat pockets. I try not to remove too much to avoid some hollowness under the eye, and just a minimal removal of the skin and the muscle. Pretty much you're done with your facelift. Typically my patients after 2 weeks they get the very decent result and they can go back to work in 2 weeks. Please take a moment to explore our website. You can email me photos. We can have a virtual consultation, and make sure to always deal with a board certified surgeon. We'll be more than happy to take wonderful care of you.